Coming to vata vata anubandha vata raktha or kevala vata raktha, here it is very chronic cases only have vata anubandha vata raktha, that is the calcaneal spur or plantar fasciitis, that is chronic for 3 to 5 years, more than 5 years, etc. And the pain in all other cases, in kapha cases and pitta cases, you will find that the pain only increases when the patient wakes up from bed, and then it decreases after some point of walking, etc. But in vataja cases it does not happen like that. Pain is chronic and pain continues. In fact, pain increases after the patient goes for a walk. After the patient goes for a certain amount of walking, and the pain increases because it is so chronic that it has affected the joint. Any kind of joint movement will cause pain. Again, I tell you, and there is a very little hope in curing chronic or kevala vataja or vatanubandha vatarakta. And very rarely patient gets cured, or it is only the symptomatic relief that we provide to the patient, and the patient has to take medicines regularly in order that the pain does not come back, or the bone does not get damaged further. So that is only the part of management we can do, and the cure and hope is very little for that particular type of patient, whereas pain management and symptom management is excellent in that particular condition. Whenever something is chronic and whenever we manage a symptom, and it is very important for the patient to follow Ayurveda, because they are going to take up certain medicine for a longer term, and they have to make sure that the dosha samhita is attained, the patient does not get any side effects out of that medicine, because they are taking it chronically. And especially in that particular cases, it is very important to follow Ayurveda, rather than telling, oh, in Ayurveda it is only manageable, it is not curable. Because Ayurveda provides a better solution in terms that the patient takes the medicine for 50 years also, the patient does not get any side effects, and the body stays in hemostasis. So it is very important in chronic cases that the Ayurveda must be followed, rather than in other cases. People tell, hey, it's not curable, why go for Ayurveda? No, you should go for Ayurveda, because it is the sustaining management. Because while treating, Charaka said, while treating one dosha, you should make sure that you are not increasing the other dosha. While treating one condition, you should make sure that you are not increasing the other condition. So, in chronic vataja, vatarakta or vata pradhana plantar fasciitis and calcaneal spur, even pain increases on walking, etc. You can see that. And you have to choose Ushna and Snigdha. Some form of Sneha should be there in Vata, because to prevent, to do the softening of the joints, and to prevent the Rukshata that is increasing, and to prevent the Dhatukshaya that is happening. There is a tablet called Barcalvin in AVN, Barcalvin, that is very effective in calcaneal spur or plantar fasciitis in Vata cases, and it gives excellent result that can be taken for long time too. And Gugulu Tiktaka Gritam is very effective in Vataji cases, because it is Ushna also, it is having it contains Gritam, and it is Asti Brahmanam, etc. Gugulu Tiktaka Gritam is used. When it comes to Kashaya, you can use Rasna Dashamulam Kashayam for pain relief, because as I said, Dashamula is Vata Pradhana Mutrala. Rasna Dashamulam decreases pain very nicely. Instead of choosing Rasna Saptakam Kashayam, which is extremely Kafara, you can choose Rasna Dashamula Kashayam, which is a little bit Balya. And you can also choose Gokshura Gugulu, you can choose Chaya Darshanga Gugulu, and you can choose Tailas which are Asti Brahmana and Dhatu Brahmanas, like Gandha Tailam and Dhanvantram 101 can be chosen in chronic cases and can be given regularly to prevent this. Any kind of Vata Pradhana Vata Rakta should be treated minimum 3 to 6 months, and after that external applications has to be continued, or a single tablet of Gandha Tailam or Barcalvin, etc. has to be continued for 1 year. So, for external application, I give Murivenna plus Dhanvantara Thailam, or Murivenna plus Mahamasha Thailam, etc. depending on the condition, depending on if there is too much of muscle wasting, severe muscle wasting, go for Mahamasha Thailam. Before giving Thaila, etc., you ask the patient to keep the leg in hot water that is mixed with salt. Take a bucket of hot water, mix some salt in it, and keep the leg in it. That will depressurize the particular part and give excellent pain relief. And after that, if they apply Thaila, it will be very excellent.